Good morning, everybody, and welcome back to your Monday edition of your Lunch Break Live. Today, again, is Monday, whether we like it or not. It is April the 12th. And today I have a fun special guest here. This is our Alabama Education Lab editor, Ruth Servan-Smith. She is here to talk to us about an event that the Education Lab is hosting today. Now, I know everybody is probably thinking when event is being used at this point, we are talking about virtual. Hopefully have some in person at some point, but right now this event is virtual today. So we're going to talk about exactly what is happening at this event, and we're going to talk a little bit more about some of the topics that are going to be covered in this panel discussion later on tonight. And that really focuses on mental health in schools. So if you have questions, please leave them in the comments here. I'm going to be monitoring them as they come in. And we're also going to leave a link to that event page. So you can catch that event starting at 12:30 Central Standard Time today. So Ruth, I know that we kind of gave a little nutshell version of what is happening today, but I know there's two separate parts of this event. So tell us what we can expect today from the Alabama Education Lab.
Yeah, good morning, everybody. We are hoping that you will tune in at 12:30 for a live virtual showing via Facebook Live of a documentary from the iHeart Public Schools team. This is a short 50-minute documentary about a team at a Nebraska school that focuses on helping children get through difficult circumstances and especially focuses on making sure that their mental health is taken care of. This is the third of 3 documentaries from the iHeart Public Schools team. We picked one that is most directed at the help these school staff are providing. But if anybody's interested, you can also check out ones that are around social media, bullying, and other aspects of mental health that kids might encounter.
So we have that screening. It's called The Mind Inside. That is the name of the documentary. It's 15 minutes. It begins at 12:30 CST. We have the link here in our comments, and you can click there, get all the details about how to watch at 12:30. Now, that is kind of part 1 of the event, Ruth. Now, part 2 happens later on this evening. That's at 7 p.m. Central Standard Time. Tell us what happens then.
Right. So I'll be on at 7, and then 2 of the people featured in the documentary, Brandy Busher and Jay Johnson, will join us virtually. We'll also have Gayla Cattle with the Alabama Department of Mental Health and Jimmy Johnson with Florence City Public Schools joining us, and they'll each be talking about how they help children's mental health in their own, environments. So you might be wondering what Nebraska has to do with Alabama, but we will be, bringing that home and helping people understand how some of the programs in Alabama operate and what we can take away in helping the kids in our own lives.
Now, something I want to quickly address, because I saw a couple comments about this the other day on some of the posts about this event. We know that we have some teachers who are interested in watching this event, especially the documentary at 12:30. Totally understand you might be teaching or you might be working at that time. But even though this is a live event, you can still watch the video after it is live. So again, you can click on that link that we dropped here, go to the event page, and then even after the technically event ends, you can still watch that video there. So if you are working and you think that you're going to miss out on it, don't worry, it will be there for you. So Ruth, let's talk a little bit about some of the topics that are kind of on everybody's mind if you're a parent, if you're a teacher, and the things that are going to be covered in this documentary and on your panel. And a lot of that is mental health in schools. We know that over the past year, 2020 through the beginning of 2021, many of our kids have been doing virtual schooling. They have been doing some form of maybe dual schooling, in person and virtual. And we know that that can have an impact on mental health. Something that I think that I would love to hear your thoughts on and your panel's thoughts on as well is sometimes when we talk about mental health, we don't really think about our kids. We think about our adults, and we think about even sometimes our teenagers, and not our kids that are younger than, say, 18. Do you think that's something that other people think as well and other people worry about as well?
Yeah, certainly. So when we started reporting on a story in February about this program in Florence, we were surprised at, imagine how hard it is to access mental health care as an adult. It's often even harder for children. because they need transportation to a therapist. They need a way to pay for a therapist. They need, a trusted adult who can be around with them and help them work through, both the issues at home, but also the actual therapy and behavioral lessons. And so one of the things that has come out in the pandemic is that schools are some of the most effective places to give mental health care for kids, simply because they're there for 8 hours a day with trusted adults. They're already there. They don't have transportation barriers. But then obviously when schools are closed, that removes that option for a lot of families. And so we know that it suffered, even as hard as it was before the pandemic. It's been even harder for a lot of families during the pandemic. And then the stress present for families, loss of income, things like that have added barriers and increased stress and anxiety for both the adults and the kids in the family.
Is there any sort of state or federal program that gives help to kids or to students in schools? We can even take away the word kids and think of our high school students. Is there any federal or state program that provides some of that help that you're talking about?
There are a few federal programs that give health care generally to children. So CHIP is one. Expanding Medicaid would increase the ability of many kids and families to access mental health care specifically. I'm not aware of a specific federal program for school-based mental health care. I might be wrong. I do know that some places are using CARES Act funding and American Rescue Plan funding specifically to direct mental health funding towards schools. It's part of the broader recovery efforts.
Interesting comment here I've got from Jessie. And Jessie says that Trussell C schools are trying this now. And she says that as a parent of a special needs child, it's not been working out for them. And Ruth, I'd love to know if you have heard from parents like Jessie or other parents of special needs children or children with special needs and their experience in some of these programs.
Sure. I have not heard specifically, so Jesse, I'd be happy to hear more from you at some point. But we do know that it can be hard if somebody has a special needs child with very specific behavioral or developmental needs to also access mental health care. There's also studies that have shown that special needs kids have suffered at higher rates than the rest of the population during the pandemic. And so I would certainly understand that, having a therapist around doesn't necessarily solve all of the issues of a family. It really comes down to having pretty individualized care in that situation. And sometimes schools still need to do more work to make sure that they get that.
Now, and I will be interviewing somebody from the Exceptional Foundation later this week. If you have other questions about people with special needs and the care and things that they have suffered during the pandemic, please let me know because that will be coming up one day this week. So Jesse, you might be interested in that. Now, another question that I have seen is people that say, look, we have always had the opportunity to have maybe a counselor in our schools or a licensed therapist come to our school. How are these mental health-based programs in schools different than that?
Sure. So there are some longstanding programs in Alabama. Florence's, for example, has been around since about 2002. This state funding is expanding that so that more schools can have that. The goal would really be to have a mental health therapist in every school. And so families might already have access to their own occupational therapist, behavioral therapist, mental health therapist. This doesn't take away any of that. It just adds access for families who wouldn't otherwise have that.
So I know, again, the documentary is called The Mind Inside. That's at 12:30, and that panel starts at 7 p.m. Both of those times are CST time, Central Standard Times. So I know that something that you're going to talk about with your panel tonight is that mental health aspect and the possible and maybe even probable decline in students' mental health over the past year. And I know we touched on that briefly, but I'd love to know if there's a way to measure that. I know you're going to have an official from Alabama on that panel, but is there a way to say we know X amount of students have suffered this type of mental health issue or this type of behavioral issue? What kind of measures are in place for that?
So there are studies happening right now nationally. There are researchers looking at an increase in emergency department visits, for example, among children for mental health concerns. Those have gone up like 25%. There are also studies looking at a potential increase in suicides among kids under the age of 18. There's also studies saying that they think, or the Centers for Disease Control and Prevention thinks that the number of children reporting anxiety, depression, other mental health concerns have increased during the pandemic. A lot of those are pretty preliminary with small study groups, and so we'll definitely need to do more work to understand the full impact of the pandemic. There's also been some news reporting around specific anecdotal reports of children reporting more stress and anxiety. There was a pretty significant New York Times report about an increase in suicides around in Nevada. And so again, a lot of it is pretty preliminary and more research will need to be done. But it kind of stands to reason that if you're at home all day, if you are around a family that is under more stress, if you're isolated from your friends, that general mental health concerns would increase. And so we'll just need to do more work to understand exactly how far that is going.
I know that you are moderating this panel tonight with several very special guests. Now, what are going to be some of your hot questions, some of your top topics to talk about tonight?
Well, of course, I want to know what you just asked, which is what they're hearing from families and children about the pandemic's impact. I'm also very interested in the two Nebraska folks and how they run their program. One of the people we're having on is a student services director who helps work with kids as they go through health and human services, truancy court, juvenile detention. And so she sees children in a bunch of different environments. And I think that's really useful to understand how children with mental health concerns sometimes end up interacting with a lot of other, government services as well. Jeremiah Johnson is a school resource officer. And so he has a perspective that his role as a police officer and school resource officer is to help keep children out of juvenile detention and truancy court. So I'm just interested to hear a little bit more about how they do that. Of course, Jimmy Shaw, sorry, I think I said his name was Jimmy Johnson earlier, but it's Jimmy Shaw. He inherited this school-based mental health program in Florence. And so I would love to know kind of how he sees that moving forward as the state expands funding and continues to help more and more children. I think they helped about 300 children last year. And so I would imagine the goal is just to continue adding resources to help more.
And one final question is something that you are going to talk about tonight, the capacity in schools and bringing kids back to school after this pandemic year.
Sure. So we actually know that most children in Alabama are now back to in-person learning, and the rest have the option, almost 98% or something like that, have the option to be back in in-person classes. And so it might be easy to think that these mental health concerns about the pandemic are gone and handled, but we know that they might persist even after the specific pandemic reasons for them happening is gone. And so, we just want to make sure that these good practices can be spread, and that parents and people taking care of children can be mindful of any warning signs and know how to help any of the kids in their life.
That all sounds great, Ruth. I know everybody's excited. That documentary screening starts at 12:30. That is the screening of The Mind Inside. 7 p.m. Ruth will be moderating that panel that she mentioned. Again, Ruth Servant-Smith, editor of the Alabama Education Lab. You can find all of the information about today's events in this comment that we have posted in the comment thread. And Ruth, we're looking forward to it, and we look forward to seeing you there.
Thanks so much, Ivana.
Thank you, Ruth. Everybody, thank you so much for watching. We will see you tomorrow.